7:33. Listen up here. Supermarkets and grocery stores across the tri-state pulling Boar's Head deli meats off their shelves in the wake of a deadly Listeria outbreak. So far, there are a total of 12 reported cases in New York, 2 cases in New Jersey, and one of those patients died. A total of 13 states have so far been impacted here.
Yeah, the Listeria outbreak may not only be tied to Boar's Head deli meats, but to vegetables as well. Infectious disease specialist Dr. Marina Keller from the Westchester Medical Center joins us this morning to walk us through some of the precautions that we can take to keep our families safe. So good morning to you. Thanks for being here. I mean, that's something that we all have to worry about as families. You know, you give your kid a turkey sandwich. I mean, what is it exactly that we have to worry about? Because 7 million pounds of Boar's Head deli meats has been recalled. Will there be more?
Right. Well, we don't know. It's a slow-going process. The symptoms happen over a long period of time. So we could have more recalls moving forward, like we've had multiple updates in this current recall.
And then to vegetables?
So the problem with Listeria is it doesn't mind refrigeration. So it can go from cold cuts that are contaminated to vegetables in your fridge, or a fridge in a restaurant or a deli.
So best if you had that Boar's Head meat in your fridge, throw out the vegetables
Throw out the Boar's Head meat. Make sure you wash your fridge really well.
Let's talk about Listeria first and foremost. What exactly is it, and what are the symptoms that people may have from it?
Right. So Listeria is a bacterium. It can contaminate food. And there's 2 forms of Listeria. The most common form is just a regular food poisoning. You have some cold cuts that are contaminated, you didn't realize. The next day you feel, your stomach's yucky, you feel nauseous, maybe you have a little diarrhea. Goes away in a day or 2. Most of us don't see a provider for that. But there's 3 groups of people who should be more concerned about Listeria and watch out for symptoms that can happen later on. And those 3 groups are people who have immune problems, women who are pregnant, and folks over 65. So they can develop the more serious form of Listeria that happens a lot later. It can happen up to 2 weeks even later after eating the contaminated food.
Wow. And how do they test for Listeria?
So people who have those symptoms in those categories, the testing is very different. It depends on what their symptoms are, where in their body it is. They have to see a provider and get specialized testing.
Well, so what are you thinking then? So for 2 weeks later, if you're in one of those age groups, you may not remember that you maybe even had a sandwich or some of that deli meat. So what are you looking for? The same things with upset stomach and diarrhea?
No, so the symptoms are totally different. And like you said, since it happens so much later, you may completely forget that you had cold cuts. That's why for those 2 high-risk groups, we recommend they avoid cold cuts, eat cooked meat. So the symptoms are very vague. You have a cold, fever, chills, muscle aches. You might think you have like COVID or flu-like symptoms. So it could be really vague, and it could range all the way to really severe, like meningitis symptoms, a headache, change in your consciousness, a stiff neck. So symptoms can be all over the place. So we really want folks in those 3 categories that are high risk to pay attention.
So then obviously the treatment is different.
Yeah, exactly.
Right. And what could it lead to hospitalization? Yeah, definitely.
Yeah, so many people in this outbreak they were detected during a hospitalization because they get that sick.
So you were just talking about how we should clean our refrigerators if you happen to have this, Boar's Head meat or any other type of deli meat in your refrigerator. But what other items then should we clear our refrigerators from, and what should we avoid at this time until this outbreak is completely, or at least for this time, gone?
Well, first of all, go on the CDC or FDA website, look for a list of recalled products, because every day it could update. Throw that all out and clean your fridge. You can just use regular cleaning solution. You don't have to use bleach. And you don't have to throw everything out in your fridge. And just make sure you have cooked meat is really important, because that kills the bacterium.
Okay, so I'm right now thinking people might be panicking if they had a sandwich or whatever, right? So how do you kind of calm the overall fear that may be out there now that, like, okay, I did eat a sandwich, or might have been Boar's Head, I don't know, should I call the deli?
Right. I mean, there's nothing you can do about it now. You're calling the deli, I don't know if that'll help or not. And the bacterium can go to other kinds of meats. The slicer in the deli needs to be clean, because it can contaminate, Listeria can contaminate the slicer. So folks need to be careful in general, but really we're concentrating on advising the people in the 3 high-risk groups to pay the most attention, because they're really at risk, much more than the general public.
Okay. So in the meantime, stay away from it.
Probably a good idea right now.
Okay. All right, Dr. Keller, thanks again for taking the time to come in and speak with us.
Appreciate it.